Well, it's an incredibly big day for the Isle of Man. I say that because health affects us all. And from today, the Isle of Man government has handed over the responsibility to health, and they're putting it at arm's length. Andrew Foster is the man who's going to be running this. And obviously, the question that keeps coming up is exactly how does this work? And do you feel comfortable that you've got enough autonomy between you and the government, yet at the same time you've got to work together?
Yeah. I mean, the fundamental change that's taking place is that up until today, both the provision of healthcare and the strategy and the policy have all been run by the same people. From today, provision is separated. So I and my board, our only obsession is making the delivery of healthcare as good as it can possibly be, and we will not be distracted by other matters. So yes, we are created as an arm's length body. We're given a range of powers, a budget, in other words, to enable us to manage our own affairs. And this is not really an experiment. This is a really common model of healthcare being delivered around the world, and it's really found to be essential to make sure that the concentration is really on the most important, the experiences that patients and users have.
Many people will see this as just more bureaucracy. I mean, it's got to be paid for. This is an extra chunk of money to be put into another layer in the system.
Well, I think the problem with health services throughout the world is not that they're overmanaged, but sometimes they're undermanaged. And if you're a patient, you can sometimes experience that. You'll sit there thinking, well, who's in charge here? Why isn't somebody organising things better? And so the level of management that there will be in Manx care is actually probably on the same scale as you would get in comparable delivery systems. If anything, on the light side, so we will try to be as economic as possible. But management is not a bad profession at all. Management is about getting things done properly and well, which is what everybody wants to happen.
I suppose most people just want to know what differences will this make? And will they get a better... Well, you're obviously hoping for a better service, but how do you put that into effect? Where do you start looking, in fact, for those improvements? And so, the person that's in the hospital, how will the end user experience something different?
So I think there's three ways that patients will experience things better over the next 12 months. So the first is in terms of performance, by which I mean waiting times. So there is quite a problem with the amount of time that people wait in accident and emergency, for outpatient appointments or for operations. Now, what we want to do is to reduce those waiting times progressively year on year, every year. So performance is one. The second is quality. What we have not had on the Isle of Man is a data system that reflects patient care. So, for example, we don't code episodes of care at the moment. So that means that we can't say what the survival rates are for a particular disease. We can't say what the average length of stay in hospital is for a particular procedure. We can't say the outcomes for various interventions. By introducing measurement of those, which we are doing from the 1st of April, we will be able to benchmark them against other services throughout the world and show where the improvements can be made to clinical outcomes. The other really important thing is that so far there has not been a systematic involvement of patients and users in the design of healthcare. That is something that we will be starting from as under Manx Care, that it will be a routine to have patient and user representatives to be involved in the design of services, in delivery of services, in giving feedback of services. So that gives us the information we need to continuously improve those services. So those are some areas where you should see improvement quite soon.
Now, what are you going to do about morale? I'm talking about the workers now, because there's been clearly issues up at the hospital, and they're well documented to some degree, but there's just this general feeling that things haven't gone well in the past.
And I think that is reflected in things like staff surveys and cultural audits. There are measures that demonstrate that is the case. Now, I think part of that is actually creating Manx Care itself as a self-running body, which will actually use the experience and expertise of its staff to improve matters. Now, I'm not just saying that. My personal track record is of running an organisation which was the third best staff survey results in the whole of the NHS in the UK. And that was achieved by listening to staff and then by doing what they said or supporting them to do the improvements. And it's that inversion of the running of healthcare from the philosophy that the people at the top know best to the philosophy that the people at the bottom know best. And that's what we found, in my experience, really, really improves morale and engagement. And that's the way we'll be operating.
Do you get your hands dirty? And by that I meant, going around the hospital, talking to people, hearing their beefs and that sort of thing then?
As soon as I can get onto the Isle of Man, I will be doing precisely that. But ever since I've been in post, it has not been possible to visit the Isle of Man. But I certainly will. And, we've been able to appoint a fabulous chief executive, Teresa Cope, who has been on the island since Christmas. And she is spending an awful lot of her time out and about in the organisation, not just in Noble's Hospital, but in the community service elsewhere as well. And I'll be doing the same just as soon as I possibly can.
Well, therefore, you bring up the obvious thing here about the situation with just the world and the way we're going at the minute. Has this made it much more challenging to launch at this particular time?
Well, it would have been better if we'd had a personal presence, but we've been doing the best we can using virtual methods. So we've held about 6, I think, listening events for staff where we've had to do them by Zoom and Teams. But basically starting off that process of saying to staff, what do you like about working here? What don't you like about working here? And what could we improve very quickly? What could we change that would improve your working life? So that process has started remotely, but as soon as possible, it will be done much more face to face.
Now, turning to the patient, we hear that sometimes it's hard to lodge a complaint. If something's gone wrong, it seems to be just buried in some circumstances as far as getting a result. How should the patients feel better about informing someone if they're not happy with the service?
Well, I view complaints as really sort of little golden nuggets that will help us to improve services. And we're talking about setting a standard of responding to complaints within 20 days. Now, there are some that we'll be able to respond to much, much quicker than that, and we will do where we can. But it's quite often the case in complaints, in my experience, that it's about a long and complex patient journey. And to respond properly, you need to find and speak to quite a lot of individuals. So, as I say, there will be a big focus on complaints because it's part of our patient and user service emphasis. And there will be standards for the speed of response, which I hope will be better than people have experienced.
Well, finally then, how long should people give you to get this underway that they can see a marked difference in the way it's been handled for the cost it's putting on the taxpayer?
Well, I am very confident that there will be measurable improvement in the timescale of the first 12 months. But the real ambition is to go further beyond that. And for us to aspire to be, and I'm not exaggerating, the best healthcare system on an island in the world. And the opportunity that we have to do that on the Isle of Man is superb because we've got the model of care, of primary, secondary, social and mental health care, all working together in a single organisation. That is something that the rest of the world is trying to achieve, and we will start with it on day one.
Yeah, you'll still have David Ashford, I was going to say breathing down your neck, but he's a nice guy. But he'll want to know exactly where you're up to, what's going on, what you're doing, those sort of things, right?
Quite right, yeah, and you're right. He is a great guy, but I've been used to working in systems where there are ministers, and ministers are voting taxpayers' money to be spent on healthcare services. Of course, they need to know that what's going on is heading in the right direction, and the opportunity to have their say and set policy as well.
I suppose the question is, this arm's length, again, back to where we started, who has to give in to who? I mean, if you have a difference of opinion.
Well, ultimately, the people are our masters as expressed through the politicians. But there is a structured arrangement set by where we're given our budget for the year. That budget will not be interfered with. The day-to-day running of the services will not be interfered with. The conversation that will take place will be about future direction of strategy and policy. So that's the way the relationship will ideally work. But, we haven't even started yet. We need to make it work as well as we can.
And how will it work for you? I mean, the CEO was meant to be doing 3 days on and back to the UK. Will you be based here, or will you be on the same sort of air miles system?
Well, the new chief executive, Theresa Cope, she has moved to the island. She is working full time there, and she is living there. I am planning as soon as I can to come about 2 days a week to the island, and I will do that, most weeks of the year. But I'm the chairman. I'm not the chief executive. The role of the chairman is to manage the board and the relationships. So Theresa will do the day-to-day work.
Okay. Finally, just as a parting word, people should have confidence in how this has been set up. I mean, you know what your terms and conditions are. Are you happy with what you've been asked to do?
I'm very, very happy with it, and I think the reassurance I can give to people is the track record of having done it before. We're not inventing something new here. We're doing something that has been done throughout the rest of the world, which I've been doing for the last 30 years, with measurable improvement results that are tangible. And I've got every confidence that with the great executive team that I've got, we'll be able to do the same.